Yes.
Local government president.
How are you?
Good morning, Mr. President. Good morning, ladies and gentlemen, officials of the Ministry of Health and the Ministry of State and the Liberia Law Reform Commission. Today is a seminar event in terms of the landmark law that will be presented to the President on the establishment of the Liberia Health and Equity Fund. As you know, Mr. President, this has been one of your flagship programs that you initially mentioned when you came to office. In fact, in your first inaugural message, your first annual message, you clearly stated that you wanted universal health coverage for all Liberians, and that it was important that every Liberian had that coverage because we owe it to our people to be healthy. And so as a result of that, the Ministry of Health, the Office of the Legal Advisor to the President, and others evaluate a draft bill on the establishment of the Liberia Health and Equity Fund and its management. So today is a great moment for all Liberians to celebrate. With that, I would like to ask the legal advisor to say a few words before we turn it over to the Minister of Health.
Mr. President, this was about finding a solution to universal coverage, and we needed to identify sources of funding, especially that can sustain such a program where almost everybody in the Republic can have access to health care. So when the initial draft bill came, we had to refer it again to the Liberia Revenue Authority and to the Ministry of the analysis of payment stream.
Excellency, I want to say thank you for giving us the opportunity to come and present the bill to you. Upon assuming the office of the Ministry of Health, we instructed us to work on this bill, and we have been working with stakeholders that will present that to you for the endorsement and all was submission to the Senate. I'm asking that to come into the presentation on behalf of the Ministry of Health.
Before that,
So, ask Martin to introduce himself.
Good morning,
the Assistant Minister of Policy and Planning.
Good morning, Mr. President. My name is Dr. Anthony Alfonso. I'm the Assistant Minister of Statistics. Good afternoon, Mr. President. I'm Mr. Philip Lula. Good afternoon, Mr. President. My name is Dr. Richard J. Davis. I'm the Director of the Health Financing Unit of the Ministry of Health.
Mr. President, I'm Chief Martin Dumas, Director of Policy and Planning, Ministry of Health.
Good afternoon, Mr. President. My name is James Keza Jara, Legal Counsel, Ministry of Health.
I'm Gosling McConaughey, and I'm the Senior Advisor to the President.
Good morning, Your Excellency. I'm Councilor the National Law Reform Commission.
Good afternoon, Mr. President. Councilor Mohan Yambama, the Chairperson of the Law Reform Commission.
Good afternoon, Christian Dunbar, Senior Advisor, Investment Finance.
Good afternoon, Daniel Kwabo, Director General of the Cabinet.
Councilor Pushkin Kinta.
Councilman Myers, Deputy Minister and Acting Minister of Finance.
Bill McGill Jones, Deputy Minister for Administration, Acting Minister of State.
Article George Sark, Assistant Minister of State for Public Affairs.
Welcome, Your Excellency. My name is Jay Washington Party Request, and I'm the Assistant Minister for Development Planning, Ministry of Finance and Development Planning.
Good afternoon, Mr. President. My name is Sylvia Brown-Pay. I work for the NRC.
We will now ask Dr. Doe to kindly do the presentation on behalf of the team.
Thank you, Mr. President. This is the Liberia Health Equity Fund, which is the health coverage bill. And when we say universal health coverage, we're concerned about ensuring that everyone has access to health care without having to worry about financial hardship at the point of service. And that's what we're trying to get with this. And these are the various stakeholders that have been involved at one point or another in the crafting of this bill. So the Ministry of Health has been the main one, but we've had workings with all the other entities listed there. So firstly, to understand why this matters now, this is a statutory financing and purchasing platform that would be able to reduce the catastrophic health spending and be able to expand the access to healthcare that people have. So with this bill, what we're asking for, if this is enacted, it will lead to the creation of the Liberia Health Equity Fund. And that fund will be governed by, or it will be managed by, the Health Equity Authority of Liberia. Once that happens, the next step would be to pool resources, and that would be through statutory contributions, levies, and appropriations. And then this managing body now would be the one responsible for contracting certified healthcare providers and defining the various benefits. If we have all of those taking place, this will ultimately lead to financial risk protection for citizens and the residents. So the bill establishes this fund, and it's not just an insurance product. Some of the reasons why this is very important at this particular point in time: the resources from the government alone is not enough to cover everything we need for universal health coverage. And over the years, we've noticed a decline in donor funding or donor support. Right now, we still have a very high out-of-pocket spending when we look at the spending on health. So considering all of these and the fact that health or access to healthcare is a basic human right, this is more important now than ever before. So this bill creates the fund, which is a mandatory health coverage scheme, and the governing body or the managing body of that, which is HEAL, will be made up of three main persons. That will be the Director General, who will be heading the organization or the managing body, and then they will have two deputies, a deputy Director General for Administration and Finance, and a Deputy Director General for Technical Services. So once we have those two, the ultimate beneficiaries of this would be all the citizens and residents within the country. How is this going to happen? How do we get the beneficiaries and enrolling them in? It's a mandatory membership. So all citizens or legal residents of Liberia would become or would be members of the Liberia Health Equity Fund. And they would then be enrolled under the scheme. For contributors, the citizens, permanent residents, and other persons that will be determined by the authority, which will be the managing body, would be able to give the specifics of that. There would be some people who might be exempt from deductions, and those include indigent persons, children less than 4 months, or the elderly citizens. And this would be based on securing of funding to be able to source this. How do we intend to fund the scheme? There are 4 broad categories. The first is through direct contributions, looking at public financing, levies and taxes, and then other flows, other inflows. Now, to give more specifics on that, we have the first one being the formal sector. For the formal sector, we're proposing anywhere between, and this was done with our counterparts from LRA, MFDP, and NASFOR. We're proposing anywhere between a 0.5 to 1.5% of the salaries that will be acquired through NASCOR, and this will be shared between employer and employee, paying some portion of it. We understand that the informal sector makes up a huge portion of our working class, and that was one of the main concerns. So for that group, we decided that there will be a periodic lump sum contribution that would be paid through their various unions, associations, or otherwise. And this will be collected and remitted by the Liberia Revenue Authority. Since next year, the country is we're proposing anywhere between 1 to 3% of VAT collections. And with your guidance, Mr. President, we can have a more specific number based on what you might think is the best way forward. It's only fair that things that cause damage to health would also in some way be responsible for paying for it. So we have excise tax on things like alcohol, tobacco, or sugary drinks. And one of the other innovative ways that we thought of for this is a 1 cent surcharge on all mobile money transactions, which to the individual, 1 cent might be negligible, but when it is pooled with all of the various contributions, it would make an impact. Similar to the excise tax, all manufacturers or distributors that are involved in any activity that may cause environmental pollution to also contribute about 5% to that. Then for concessions, we have Class A and B mining concession companies that will also contribute to that. And the last one that we identified here was there will also be a levy on companies offering health and health-related insurance services. Now, for the management of the fund, which is what we shorten as the Health Equity Authority of Liberia, and we just call it HEAL, looking at what their functions are. They would be responsible for registering members, issuing membership cards, enrolling the exempt persons, and designing the informal sector enrollment programs. They will also be responsible for collecting the funding, operate and manage the scheme, and reserve the funds. They are also responsible for certifying the various health service providers, contract the services, and then they pay the verified claims. Until this happens, right now the Ministry of Health is doing the last part in terms of conducting public education, but once this goes through, that will be another function of the authority. So conduct public education, build the capacity of the people, develop guidelines and manuals, and support the entire universal health coverage policy formulation. How do we intend to get all of this done? Based on discussion with the Ministry of Health and other health partners, we have the essential package of healthcare services, and that is what is going to be used to design the various benefit package for this scheme. It differs depending on the level of care, and that will just be done in consultation with the Ministry of Health to ensure that we have these things being provided. The authority will also be responsible for certifying providers. Government facilities alone will not be able to provide all of the services that are needed. As such, there would be a predefined criteria for enrolling both public and private facilities into this, the service provision aspect of the scheme. So this authority will be responsible for certifying those people. And once they provide the services to the people, there will also come now the issue of repayment. So that's the payment mechanism, or we call it reimbursement. And that can be determined specifically by the authority's regulation, but it would be either on basis of, it could be fee for service, it could be case-based appointment, but the authority from that pool fund now will be able to reimburse those facilities for providing the services. One of the concerns that come along with such things would be issues of claim control. Because when you start having services like these, there's a possibility for fraud and unsubstantiated claims. So another thing that they will be doing is to be able to verify all of the claims, and they may deny any false or incorrect claim or unsubstantiated claim. For the governance and accountability, the authority now would also be governed by a board of directors. And there would be, the fund would be subject to regular audits by the GAC, and they would also be subject to laws, rules, and regulations applicable to any public fund. There will be periodic reporting to the board, and annual reports would be given to the president and the legislature. In order to avoid any conflict of interest, all members of the board or the authority would have to disclose any potential conflict of interest before engaging in service provision and so on. So specifically for the board, the Minister of Health would chair, and the co-chair would be the Minister of Finance and Development Planning, and the other members of the board would be from the Ministry of Justice, Ministry of Local Government, the Central Bank, Ministry of Gender, LMDC, National Civil Society, and NASCOR. The Director General of the authority would serve as the secretary to the board, and he or she would be a non-voting member. So this board would then be responsible to vet and nominate 3 persons for each of the 3 positions mentioned, and the candidates that are nominated, then the president would select one of them, or appoint one of them for the various roles. The board will also be responsible for approving the annual plans, programs, budget, and strategy of the authority. They will ensure legal compliance with investments, contracts, and MOUs. They will receive the reports from the Director General and submit annual reports to the legislature. And they also would ensure that the implementation of the Act. So there are several safeguards, integrity safeguards that have been put in place to try and maintain the quality and the integrity of the entire fund. So patients and their beneficiary data would be protected from unauthorized disclosure and access. And any breach of that will be punished under existing laws. There will also be sanctions and service use control. Some of the other challenges that come along with these is when you have these sort of things being available that people can access healthcare without having to pay or to experience financial hardship, there's a propensity that people would tend to overuse it. So there are also safeguards against those. And even from the provider standpoint, sometimes people may overprescribe, and those are all things that have been considered, and there have been several safeguards put in place within the proposed bill. There will also be member protection that is safeguard against wrongfully charging scheme members for services. For benchmarks, there are several things that are needed for transition readiness, and those fall under governance, planning, financing, benefits, purchasing, and operations. There are also legal alignments, which will be amendments or severability of other laws and so on based on the passage of this. So for implementation decisions that we need to, or that would need to be sorted out early, funding certainty for exemptions. In order to be able to provide the care free for those exempt groups I would mention, we will have to secure dedicated funding for them. There will also be regulatory sequencing on contributions, provider certifications, and so on. And then data and ID integration. This is where we're looking at ensuring that this aligns with not only the national ID, but also the vital statistics and birth registration. So all of these would be able to ensure that people have this unique mode of identification so that it goes across. So at this point, with your approval, Mr. President, I would like to turn over to the Minister of Health to conclude these aspects.
So, Your Excellency, we have come to ask for your endorsement. We concur with this argument as presented, and also for you to transmit the bill to the legislature. Asking under your guidance to direct me as the Minister of Health to work along with Finance Ministry, the RA Master, and other stakeholders to prepare the regulatory body and fiscal transition plan. We also ask you to instruct us to communicate to the public what we presented to you to start civic education about the narrative around the equity fund. Thank you.
So now the President will make remarks after you listen to the Health Minister, followed by
even prior to this coming to office, even during that campaign, I did talk about the need for Some people even said we're going to start doing it. Some people claim administrating money and so forth. I'm happy that you took the time to carefully look at it and then to be able to put it together. One of the things that I noticed in this country is that we have the competence right here. All we need, and I think we're coming to is to understand that the country is your country. I don't care how you feel. Country doesn't mean you. It means all of us. You can build a house, live in a place, put a gate and everything, but you have to know that there are people around you and what they do and how they do it. They have effect on you. And so, we have a lot of people in this country who are afraid to go to hospitals because they feel they can't afford. But these people are also out people, you know, sitting around here came from the same kind of background. And simply because some of us are come this far, doesn't mean that there are not people back there who have the problems that we have. And so I want to thank you, all of you ministers, special assistant, for taking the time to put this together. Insurance, and one thing I like, you know, I come around here, almost 80% of live elsewhere where you have contributed to the health of the people, and you're not benefiting from it, you like it, and you are here. So why not do it for yourself, people? And that comes through love of country, commitment, knowing that this country is yours and only you can do it. So what we need to do now is to make it work on paper. As God said, we need to educate a lot of people because sometimes we have a problem. We only want to make the laws that will benefit us. That's not what people put in the position. It's to also make the law that will work for them. The government, of course, is not in position to, we know what we go through every day. We'll come to, you know, I'm going to India, I'm going to this place, I'm going to that place. No one person got the resources to do it. We have to share it, but we have to look for means by which can be get affordable. I had said one time that if a market woman to pay $100 a month in a week, $400 a month. If we apply to all our students and things, say about $400 million. Well managed, because you pay insurance on the car doesn't mean you want to have an accident. Because you pay insurance, you don't want to get sick. So, they take care of you when you need it. So, this is a very good effort. And it means that we can give everybody a chance to be able to keep well. And also, that means that the funds can be used to attract whatever savings, like I said, good doctors, medical doctors, well trained, you know, people are graduating, they want to work for their country. the problem we have in developing countries is that we train the people, get scholarship, train the people, and give them right back to the same people because we don't want to recognize them, we don't want to pay them. And so they go back. I know that a lot of people who have gone to medical school get colleges, and they are all working. Some of them have retired in a foreign country because home, we don't care for them. We should be able to give them opportunity to serve in their country. I don't care what you do, you can make $5,000 or $10,000 a month in some of these foreign countries. And somebody here make $3,000, you can make better than you. One day in their house and so what the people are asking for is not too much, but at least we have to recognize the medical